have a wonderful speaker with us. That's Dr. Jashila, and she's going to present her webinar on evidence-based case series of Pityriasis alba treated with homeopathy. So I would like to give a short brief of Dr. Jashila. That is, she has done her MD homeopathy in pediatrics from Father Muller Homeopathic Medical College, Bangalore, and currently, she is pursuing PhD in pediatrics from Sonaji Rao Krishna Sagar Homeopathic Medical College, be affiliated to MUHS. She has also published two articles in the International Journal of Homeopathic Science and many other articles in national journals. So we are very grateful to have Dr. Jashila with us. Now,
Thank you,
now,
ma'am.
now I would like to hand over the mic to Dr. Jashila. Please, ma'am.
Thank you, ma'am. Thank you for the introduction. So I'm very glad and happy also to present the case series on Pityriasis alba. So coming to Pityriasis alba. So what do you know about Pityriasis alba so far? And my intention is to have a simple talk on Pityriasis alba, since we are seeing this Pityriasis alba in almost all the OPDs, in pediatric OPDs. So I wanted to show you how the homeopathy works and also what exactly is Pityriasis alba. And always we think that hypopigmented patches all are same, easily we can identify it. It is not so. So coming to the topic as such. So first coming to the objectives. So my objective is simple. So I want to differentiate different types of hyperpigmented patches since many students are present here. And second one is to know about pityriasis alba in detail. And the third is to witness the evidence-based cases treated by homeopathy. So coming to the definition. So pityriasis, so basically the terminology of pityriasis alba is derived from a Greek word. So in that pityrian signifying bran or bran-like, Latin word albus meaning white. Okay, so it is a white hypopigmented patches you could see here in the picture also. So hypopigmented patches. So pityrian signifying the bran and the albus meaning the white. So hypopigmented patches present, so which is called as pityriasis alba. So coming to the synonyms, what are the other terminologies which we use to describe this pityriasis alba? One is furfuraceous impetigo, also we call it as, then erythema serpentogenes we call, and next is pityriasis streptogenes. So coming to the prevalence, so how much, then what is the disease burden? So disease burden is 1.9 to 5.25%. Since many students are there, you might not be getting what is this prevalence, why we need to study all these things. So it is the disease, basically the existing disease present. So it is about almost about 5% is the prevalence. So coming to which age group people will have the affection more. So it is most commonly seen in 3 to 16 years of age. So far, whatever the study has been done. So whether it is only concentrated to one particular region of the world or it is distributed in a certain climatic condition and all, no such things. It is distributed all over the world. Okay. So is there any gender predisposition, whether female is having more or male is having more? There is no as such gender predisposition because it is equally distributed in male children also and female children also. Okay. So coming to how can you identify this pityriasis alba? Clinically, how it will be presenting? Anybody? Anybody have any idea about how it presents? So how it presents? Anybody? Anybody in the group? Anyone? Can you tell me how will you identify this pityriasis alba? So I have told you hypopigmented patches. Whether how can you differentiate it with other hypopigmented patches?
Ma'am, I guess if I'm not wrong, there is scaling present.
Okay, itching, very good. Mild itching it is, not severe itching, very good. Then any other answers? Fine. So coming to the clinical presentation, superior upper part of the trunk, that is also fine. So coming to the clinical presentation of pityriasis alba, so initially we'll have this red, pink or skin colored file lamellar or brany scaling. So usually you might have seen small, if there is a urticaria, before urticaria comes, you might have seen a small raised scaling, you can see similar like that, it starts itching. So similar like that, there will be a red, pink, skin colored fine lamellar or brany scaling, you can see. And also when you start itching, definitely there will be erythema, okay, due to inflammation. There is a persistent fine scaling, you can see, and there is a depigmentation in the later stage. So what is the size or the shape of this? Usually it will be a rounded, oval or irregular plaque formation, and also macule. So you might, it is very important for you people, since you are students, to differentiate what are the different types of lesions. So if you are in first year only or second year, you might have studied about different types of lesions. For example, macules, papules, pustules, and vesicles, and many more. So this macule is a raised edges of the skin. Okay, so usually it will be, it is not very prominently seen. So macule is very pale, and also it is light brown with indistinct margins can be seen in this. Okay, so then,
Ma'am, can
and
you change the slide, please?
sorry,
Ma'am, can you change the slides, please?
it is not changed. Just a second.
Yeah, ma'am. Also, ma'am, you can open the slideshow option so that full PPT will be seen.
Okay,
Yeah, that's the option. And screen sharing has been stopped by
just a
mistake.
second. Ma'am, is it visible? Hello,
Yes, ma'am, it is visible. You can open the slideshow option.
is it fine, ma'am, now?
Yes, ma'am, totally fine.
Yeah. Okay. So I have discussed regarding this clinically how it presents. A very important aspect of this pityriasis alba is, so whenever you go to sun and all, or you play in beaches, many children will come up, no? So whenever this patches, so it fails to tan, then it is exactly, your diagnosis will be very true. The remaining parts will be tanned, but only that part will not be tanned. So that is the exact diagnosis for pityriasis alba. So you can't forget. So one is, it is brany, scaly, erythematous in early stages. Itching also can be seen to an extent, but very mild it will be. Rounded, oval or irregular in shape. It is light brown or skin color only. So failure of the affected parts to tan. So this is patches to tan. So this is what is the exact clinical presentation of pityriasis alba. So coming to where and all it will be distributed. Can you tell me where and all it is distributed usually? Which part of the body it is distributed? So somebody have written, especially the upper trunk. Good. Then any any other answers? Especially upper trunk. So which part of the body it will be usually? Slide is not changing. On the face. Good. Then So this pityriasis alba, so 50 to 60% will be seen on the mouth and chin and on the cheeks and forehead. Usually on the face you could see this, especially on the cheeks and chin you can see. Followed by that you can see in extensive pityriasis alba, you can see it on the neck, arms and shoulders, and 10% will be having this extensive pityriasis alba on the arms and the extremities and the abdomen. You can see that. Okay. So coming to what are the probable association? You can't say the cause. Is the cause for pityriasis alba so far? What might be the cause for pityriasis alba? So anytime when you have read or when you have discussed regarding such cases, anybody have come across this is the exact cause for pityriasis alba? Screen show. Fine. So now, is there any exact cases of pityriasis alba? Sorry, causes for pityriasis alba? Fine, fine. I'll share the screen, but tell me the causes, any cause you know for pityriasis alba. I'll discuss. So there is no such cause, but only there is a slight association between these factors and pityriasis alba. So first and foremost is parasitic infection. So always whenever the child comes with boring in the nose, itching in the anal region, okay, so teeth grinding and many more. So that is the time when you can see this pityriasis alba or hypopigmented patches associated with that. So next coming to anemia. So many microdeficiencies also causes this, micronutrient deficiency also causes this pityriasis alba, but there is an association, it is not the exact cause for it. So then coming to mineral deficiencies. So if you have not properly maintained the hygiene, then also you could see this pityriasis. So there are certain studies they have done that copper deficiencies have caused this pityriasis alba. There is a much more association when compared to remaining causes. So next, sun exposure, poor skin hydration, frequent bathing, dryness of the skin, that is cirrhosis, atopy, and several soaps which causes dryness of the skin. So atopy is nothing but the allergy. So these are all the probable association for pityriasis alba. So there is no as such cause they have found out that this is the exact cause for pityriasis alba. Okay. So next coming to the differential diagnosis. So I'll keep on showing you the picture. Then you have to tell me how will you differentiate between the pityriasis alba and the picture what I'm showing it to you. First, you tell me the diagnosis of this picture. What is the diagnosis of this picture? So it is visible. So it is. So you might have heard about this diaper rashes, right? So post-inflammatory hypopigmentation. So whenever there is an inflammation in that particular area, there is a diffuse area of inflammation, and also there will be hypopigmented patches. So always, whenever you are suspecting a hypopigmented patch, it is your duty to ask, is there any infection which has happened or any irritation in the skin? So any inflammatory process has set in. So all those things, if you ask, then you will come to know whether it is a post-inflammatory hypopigmentation or it is pityriasis alba. So next picture. So what is this? What is this? What is that? The next picture, what I've shown you. Can anybody diagnose it? Can anyone tell me what is the diagnosis? Tinea versicolor. Very good. So, uh, so this is Tinea versicolor. So you might have seen is in many of the adults also, in many of the children also. So there is a small dot 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 and scaly hypopigmented patches usually seen on the forehead, but majorly you will be seeing on the back of the neck. Okay, so this is tinea versicolor. So versicolor, it is also called as pityriasis versicolor also. So it is a hypopigmented, scaly, annular, and confluent lesions which you can see. Okay, so this is the most what to tell, similar presentation of pityriasis alba. So if you miss little also, you may diagnose it as pityriasis alba. So one thing you keep it in mind, pityriasis alba will not have this confluent lesions. Many lesions it won't be there. It will be having few lesions like 3, 4. That's it, not more than that. Okay. So next coming to, this is ash leaf macule, so which you will be seeing in tuberous sclerosis. So in final year students might be knowing, first, second, third year students are unaware of such diagnosis. And final year also, if you are studying, it is difficult. Interns means you can easily make out. So this is one ash leaf macule. It is inborn. So hyperpigmented patches usually seen on the abdomen or arms anywhere. So it is always associated with tuberous sclerosis. Next, what is this? What is this diagnosis? What is that? Which I have shown you. So vitiligo. So vitiligo, as you have heard about vitiligo, so you could see the patch how it is. It is irregular shaped patches, but it is having a well-defined borders. So that is the one thing which will be helping you to differentiate between pityriasis alba and vitiligo. So vitiligo will always have a well-defined borders. Okay. Next. So this also is a nevoid hypopigmentation. It is having a linear swirl pattern you could see. So this, next coming to, this is also nevoid hypopigmentation usually see. So don't get confused with pityriasis versicolor. So pityriasis versicolor always will have a scaly thing, and also it is round, so it will not be scattered like this. Okay, linear swirl pattern of hypopigmentation of the shoulders. Next, this is pebaldism. So hypopigmented lesion on the child associated with the white forelock. You could see this. So this is not the exact vitiligo, so it is called as pebaldism. So then coming to, how will you investigate this pityriasis alba? So any instruments you know how to investigate this pityriasis alba? Is there any instruments, or how will you find out this pityriasis or any hypopigmented patches for that matter? How will you investigate it, or how will you diagnose whether it is a vitiligo or it is a tinea versicolor or it is a, so is there any test, is there any investigation process or an instrument to measure or to see? Any idea? Any idea? Any instrument or any test to identify this, or to tell that slit lamp exam? Okay, wood lamp, very good. So basically, in our clinic, we usually go for this wood lamp examination. So that is the basic requirement in every clinics. So everybody should be having this wood lamp. So this is what is the wood lamp look like. So this wood lamp, so there will be having pityriasis alba usually will be like this, and vitiligo will be like this. Okay. So wood slide examination. So always we do wood lamp examination. Why? Because vitiligo is an autoimmune disease. So always we want to see whether it is a vitiligo or it is a pityriasis. So what is the difference is, as I've told you earlier also, vitiligo will be having well demarcated borders, but when compared to vitiligo, you could see in the upper part and all, so it is not well demarcated. So this is how it is scattered. So this is what is the helping tool to identify whether it is a pityriasis alba or vitiligo, and also it will be bright. Okay, so vitiligo patches will be bright. So here what we are passing is the UV light. So then we are checking it out. Okay, so the margins will be very clear. The borders are very clear. but it here you would see it is not that clear. Okay, but the brightness is also very high in vitiligo. It is not so in pityriasis. Next, coming to, so other test also we have to find out why, because we want to differentiate it by Pityriasis versicolor, that is Tinea versicolor, and Tinea, as you know, it is a fungal infection. So there is a scraping done, and stain we use that is called as potassium hydroxide or KOH stain we call it as. So usually we'll scrape the skin with the help of a scalpel, then it will be put on the microscope. So 2 drops of potassium hydroxide solution will put on that. Then, so if there is a grape-like clusters of yeast cells, okay. So if we see this, which having a long hyphae and all, so it looks like a spaghetti and meatballs. So always keep it in mind. So for writing exams also, it will be helping you. Spaghetti and meatball appearance in the potassium hydroxide stain of a skin scraping. So then definitely it is pityriasis versicolor. Okay, so pityriasis versicolor, so pityriasis alba will be ruled out, and it is definitely pityriasis versicolor. Okay, so that is the gold standard test for pityriasis versicolor. So when in doubt, always you have to send the scrape of the skin for potassium hydroxide stain. Okay. So next, coming to, so then what will happen if pityriasis alba is there? What will happen? So is there, so we need to know the prognosis of this particular disease. So as we know, many will tell that it comes and goes. There is no time that it will be staying for long. So sometimes it comes without treatment only, sometimes it goes. So this disease will coming under the self-limiting diseases. So many diseases are called, we call it as functional, we call it as self-limiting. Many diseases are like that. Okay. So still, then we may ask, is there any exact duration of recovery is there, even though if it is a self-limiting disease? So is there any exact time duration of recovery is there, but it is not being explored. So that's why there our scope starts. So there is a chronic relapsing remitting course is also there. So that's why we are concerned. That's why we are treating the disease. Next, coming to, in patients with atopic dermatitis, usually there will be extensive pityriasis alba followed by this atopic dermatitis. So that's why we need to treat such patients. Okay. So you know the prognosis. One is it is a self-limiting, acceptable, but what is the duration of recovery is the question. So then our scope starts. So whenever there is a chronic relapsing remitting course, then we need to treat it. Okay. So next is a homeopathic part. So very basic rubrics I have taken, not much. So skin eruption, scaly, bran-like, skin discoloration, white spots, face discoloration, white spots, like this I have taken. So coming to certain therapeutics which we get it in boric and all, since you are students, I'm taking. So there are certain remedies like arsal. So there is a dry rough spots are there, scales, itching, worse by cold. So you know that calcarea calc. So whenever the pityriasis spots on face which is red in color, okay. So only one line characteristic you can take it out. So arsal, when it is worse by cold, there is a rough dry spots you can see. Scales also you can see. Itching also will be there. In calcarea carb it is red in color. So tuja, it affects usually face and neck. So it worsens washing in warm water. Okay. So then silicea, red spots on neck, which is dry and yellowish, and excessive sweating also. Sina, always you have to think of whenever there is a associated warm troubles, but it is not proven, but always you can see some association between this pityriasis alba and warm troubles. Okay. So, so this is about pityriasis alba. I guess, or I hope that in future, any cases of pityriasis alba come to your OPD, you will not miss the case. So you are now very well confident of um, differentiating between different types of hypopigmented patches, and then short you can diagnose it out with the help of Wood's lamp. Still more you will get the confidence that yes, it is pityriasis alba, now we can treat it. So this is my first objective, that is the objective of knowing pityriasis alba in detail, and the second objective of knowing different types of are differentiating different types of hypopigmented patches. Then coming to the third, we need to witness whether homeopathy is working or not. So that's why I've taken few cases for that. Okay. So cases, few pictures you can see. So it is a 7-year-old boy. He had come along with his parents. Complaints of hypopigmented patches on the cheeks with mild itching. So he was this complaint was there since 15 days. There is no history of it. Is very important to ask the history of trauma, history of infection, allergies. Okay, atopy is there, infection because we saw this post-inflammatory hypopigmented patches, allergies to know about the atopy, and also is there any trauma because of that the child was getting. So clinical presentation, there was hypopigmented patches were seen on the cheeks with faded borders. So no scales present with irregular margins of 2 patches only were seen. Wood lamp examination, there is non-fluorescence, less demarcation of edges, which has confirmed the disease. So little I have observed, the child is very playful and he is not sitting in one place. So then I asked about him, how is he in studies and all, whether any, because of this restless, is there any attention deficient and all. So no, he's good in studies, he's very active and all. And then perspiration increased on face while eating. So only these many things which I have considered. And seeing that, I have given belladonna as the remedy for 3 days. So after 1 week, I have repeated again the same, since the action duration of belladonna is only for 7 days. So within 15 days, I could see some changes in this hypopigmented patches. So this is the child who had come up with the hypopigmented small patches, you could see. So it is not very well, see in pictures and all, you can't make out very well, but you could see the changes in the hypopigmented patches. So this is the second case of a 17-year-old boy come with extensive hypopigmented patches on the forehead since 1 month, and there was a mild itching was also there. So he feels the patches are too dry. Okay, so next is he did not remember any history of trauma or no allergies or infections. Okay. So it has presented patches, especially seen on the forehead. So no scales were there, irregular margins were there. Again, I took the wood lamp and examined. It is non-fluorescent and less demarcation of edges. So mind, he was very shy the moment he entered. So anxious also, what will happen like that. His talks were like that. He was very shy to answer. And at time and when I have asked inquired, only thing what I got is he was obstinate. Then personal history, sweating in palms and soles. Sweat is offensive. Now, can you guess the remedy? Can you guess the remedy? That's very simple. Very simple. Very good, Silesia. Okay, so it's a simple remedy of Silesia. So I also have given Silesia. So I have given Silesia 200 and a placebo for 1 week. Sorry, 2 weeks. Then after 15 days, I asked him to come. So you could see the patches which was dry, which was extensive. So you could see it is fading it off. Okay. So next coming to the third case. So here a 6-year-old girl who come along with her parents. Complaints of hypopigmented patches on the cheeks noticed since 15 days. So the patient's parents did not remember any trauma, skin infection and allergy. So it was only 2 patches were seen. The same wood lamp examination also came this non-fluorescent and list demarcation. So mind she was irritable. She was crying for small matters. So she had so much of rivalry with sisters, like something they buy for her. She will be keep on crying and making it cranky and many more things. So then coming to the personal history, she was excessively sweating on head. She was a heart patient. So any cases? Irritable, sibling rivalry, excessive sweat on head, heart patient. Is there any guess? Sibling rivalry. Okay. Very good, calcarea sulf. So calcarea sulf was the remedy which I had given. Okay, so only small things matters for us, right? So remedy was calcaricel 200 for 3 days. I had given 3 doses and followed by placebo. So you could see in this photo, I could not take it out because she was very restless. So this was the patch, okay, which she had come up with. So there is the last case, a 6-year-old girl. She had come along with her parents, complaints of hypopigmented patches on the cheeks, noticed since 15 days. The same, no history of trauma, any known allergies or infection. Only thing which they have identified is she is having this grinding of teeth in the sleep. Okay, so that is the only thing what they have observed. So every time when the Pityriasis alba cases, if I'm diagnosing, always I'll ask this history of this teeth grinding, nose boring in the nose, or itching in the anal region. That is very important for me because in my practice, what I have seen is it is almost 60% it is associated with worm troubles. Okay, so clinically it is the same 2 patches which was seen on the cheeks and all. So non-fluorescent, less demarcation of edges on Woods lamp examination. So I have taken, she is very calm, quiet girl. So she was, what to tell, I asked her about, she's very jovial, she's calm, quiet, and she's having many friends. So only thing which helps me to find the remedy is whenever she gets angry, her grandpa and parent had come. So they were telling it is easy to console her. So she'll become normal very soon. So that was one striking thing which has helped me to find the remedy. So coming to the personal history, she desired for salt a lot. So otherwise also she picked salt from the kitchen and she used to hide and eat. She is having aversion for sweets. So any guesses? Aversion for sweets and desire for salt. Sorry. Desire for salt. Any guesses? If you check synthesis repertory, you will come to know. Yeah, very good. Natromure is there, but jovial, have many friends. Okay, so whether natromure will become, see, consolation will aggravate them, right? So that's why I ruled out natromure. Any other remedies? Any other remedies? Any other remedies? Any guesses? No. Pulsatilla phosphorus. Okay, so if you open the synthesis repertory, craving for salts, phosphorus also having 3 marks. Okay, so and also aversion for sweets, phosphorus is there, and becoming normal when they get angry within few seconds. If you pamper them, they will be all right. Okay, so that much superficial they are. So the remedy given was exactly phosphorus 200 was given and followed by that placebo. So you could see these are the white patches. Okay. So I could help them with all these things. Now coming to the takeaway for today's webinar. So what and all you have learned from today's webinar? Any learning from today's? Was it helpful or you were knowing everything before only? So what is the takeaway from all these cases and pityriasis alba and all? So I'll tell my experience from this cases and this. So what experience I acquired from all these cases of pityriasis alba and many more are there. So pityriasis alba is treatable with homeopathy. That confidence I got, and I can tell them within 15 days to 1 month. Give me time, I'll show you the result. So this much confidence I got it by treating. And you might have seen all the 4 cases. For me, rather than the specific remedy, I have used most of the time constitutional medicines only. So in children and all, nothing much to dig. Few questions, if you ask, that is sufficient. We'll get the remedies. Okay, so always I don't keep on asking. So if I don't get the constitutional medicine in the first sitting, I'll leave it. I'll give placebo or a specific remedy. I'll send them. I'll wait for the next sitting. They'll only open up and ask something what to tell unique about this child or nature. So like that, habits and many more things. So we'll get the remedy very easily because in a few polycrusts are there, and in that only these children will come across. So constitutional medicine has helped me in many of my cases. Then potency of choice, which gave results for me, is 200. So always opting for moderate potency will be always good. So many will tell in acutes you should go for a higher potency. In a chronic disease you have to go for a lower potency. Or so so I always maintain this 200. Only if their susceptibility, depending on the susceptibility, will be matching the potency. Okay. So this is about the topic of this evidence-based pityriasis alba treated with homeopathy. Is there? These are my references which I have used. So Rook's textbook on dermatology, synthesis repertory, and Borix Metria Medica. So is there any doubts regarding pityriasis alba? Was it helpful? Yeah. Thank you. Thank you. My intention was I only concentrated on students. If say elders and doctors are there, they know everything about all these things. But my when I was also student, the same thing which I have gone through, what are the difficulties and all. So that was the only intention of mine, is the students should be confident to prescribe. If they know the diagnosis, definitely they can prescribe better. And also, if they know the diagnosis, they can tell the prognosis of that disease, how it is going after our medicines has been given, which direction it is taking up. So only, as Hahnemann said, about this knowledge of the disease, it is very important. You think, no, symptoms are sufficient for us, we don't require anything else, nothing like that. We require diagnosis at any point of time. Okay, then only we can further. So if we are confident with the diagnosis, we can speak in front of allopaths also. If we are having a failure or we are having the limitation, we can send the cases to them. Or if they are finding any limitation in treating any of the cases, they can send. So this is what now coming up with the integrated approach is all about. So thank you once again. Thank you, Lavanya madam. Thank you, Gosami sir. And thank you, Hansi ma'am, for giving me an opportunity to present these cases, and also for giving me a chance to present this pityriasis alba topic for this webinar. Thank you very much.
Thank you so much, ma'am. This webinar was very wonderful and very informative.
Okay, thank you, ma'am.
Really like your presentation, and we appreciate your efforts.
Okay, thank you.
Thank you, ma'am.
Thank you very much.
Hello, everyone. Hello, everyone, again. And now it's time to share a news from AHISA organization that they are going to start their youth festival, Ayush Youth Festival 2025. And for the festival, we have a list of index like we have about AHISA, list of activities and conference details, competition in Ayush Youth Festival, details of activities in conference, and lots of other details you can find in the Ayush Youth Festival. And this conference also allows you to get to know about the national organizations. And there are various competitions in Ayush Youth Festivals like e-poster competition, article writing competition, drawing competition, essay writing competition, dance, singing, speech, fashion show, and whatnot. So get ready to participate in this conference. And, you can get the details of the International Ayush Conference 2025 and Ayush Youth Festival 2025. You can get all the details in the caption after the video. Thank you so much.